Hello and welcome to Tackling Malaria. This is a win-win for saving lives and preventing future pandemics. Thank you so much for joining us today. My name is Kasia Madera. I'm a BBC World News presenter and I'm absolutely thrilled to be with you here today to be your host for this very important event. Thank you so much to all the partners who've made this event possible, including Malaria No More UK, Malaria No More US, the RBM Partnership to End Malaria, the Global Fund to Fight AIDS, TB and Malaria, Friends of the Global Fund Europe, the Asia Pacific Malaria Elimination Network, and the UN Foundation. Thank you so much, all of you, for making this event possible. Now, we expect today to last around 90 minutes, but since this is live, we could run a little bit shorter or a little bit longer, so do be with us. And of course, it's such a shame that we're not with you all in person, that we have to do this virtually, but it's wonderful to be here with you. Now, this event is being recorded and you will be able to watch again afterwards on the Malaria No More UK YouTube page. So it's the Malaria No More UK YouTube page. You can get all of this once again. To make this session as interactive as possible, please use the tools within the Zoom functions to speak with each other. Also, familiarize yourself with the Q&A function within the toolbar at the bottom of your Zoom window. There you'll be able to ask questions during the panel discussion. And of course, tweet along, get on Twitter. Let's get this whole event trending. The hashtag that we're going to be using today is hashtag Malaria Win Win. That's Malaria Win Win, all one word. You can also use End Malaria as well. But today we're focusing on Malaria Win Win. So please, let's get this trending. Let's get this really interactive. Now, we've got some incredible speakers with an awful lot of experience joining us today. But before we're going to hear from them, we're going to run a little audience poll with all of you to find out why you're here with us. Quite simply, what is it that has brought you to our event today? So the question is, what motivated you to be here with us? Is it that you want to hear about the progress, the challenges, the opportunities in the fight to end malaria? Is it to understand the links between malaria investments and global health security? Is it to learn more about the role of community health workers? To find out how the G7 can advance global health security and revitalize progress against malaria? Or quite frankly, is it all of the above? So just use the buttons on your screens to submit your questions. And I'm just multi-screening here, so be patient with me. We're going to find out. 56% of you say it's all of the above. And you know what? That's absolutely fine. There's no one real reason why we're here today. We have an awful lot of questions, and we really hope that we'll be able to cover all of these aspects for you today. We've got a really fantastic lineup of speakers and panelists who will be sharing their insights and their years and years of expertise. We're going to be hearing from Dr. Abdurrahmane Diallo, the CEO of the RBM Partnership to End Malaria. We'll also be hearing from the Honourable Dr. Daniel Ngami J, the Rwandan Health Minister, also from Wendy Morton, MP, the UK Minister for Global Health Security, and Her Excellency Marina Sereni, the Italian Vice Minister for Foreign Affairs and International Cooperation. So a wealth of knowledge will be joining us. Following this, we will be joined by an expert panel who will be discussing the impacts of investments in tackling malaria for global health security and also further opportunities for strengthening community health systems. And finally, at the end of what I hope will be a beneficial conference for all of us, we'll hear from Peter Sands, the Executive Director of the Global Fund to Fight AIDS, Tuberculosis and Malaria. So an awful lot of insight, an awful lot of expertise. Please get as involved as you can. Ask your questions via the Q&A tool. Remember to tweet hashtag Malaria Win Win. So enough from me. We are now going to hear from Dr. Diallo, the CEO of the RBM Partnership to End Malaria, and his vast experience. Dr. Diallo has served as Minister of Health for Guinea, dealing with the Ebola crisis and the subsequent rebuilding of the national health system. So we're extremely grateful for his expertise and his time. Dr. Diallo, I hand over to you.
Thank you very much, Kasia. Excellencies, honorable ministers, partners, and friends, I am honored to welcome you here today in advance of the upcoming G7 summit to discuss the critical links between our global health security and the fight against malaria. As we battle the most widespread and disruptive pandemic of our generation, we recognize the need for a global public health response that strengthens our health systems to both respond to novel threats and advance the tremendous progress we have made against epidemic diseases. For malaria alone, our collective efforts saved more than 7 million lives and prevented over 1.5 billion new infections since 2000. My experience serving as Minister of Health in Guinea during the Ebola epidemic speaks to how fragile such progress can be when a novel health threat emerges. Studies have estimated that there were more excess deaths from malaria than Ebola during the West African outbreak than from Ebola itself. But I can tell you that for the families of people who lost a loved one and the frontline health workers who fought to save those who were ill, their profound personal losses did not depend on which pathogen was responsible. In this moment of global solidarity, it is important for us to take such lessons into account as we seek to build back better. The stronger health systems we build must gain practice in saving lives by delivering quality services every day in order to have the surge capacity needed to address novel health threats. As COVID-19 attacks our people, our health systems, and our economies, we note the compounding damage caused by malaria. Its high burden is not only an incredible risk itself, it further undermines our ability to detect and respond to other febrile illnesses, such as COVID-19, and affects our preparedness against other future pandemics. We will hear today from country leaders, international partners, and those working directly in the hardest hit communities about the health system investments that have been and will be critical for addressing epidemic diseases from malaria to COVID-19, especially those investments that train, deploy, and capacitate community health workers, the first responders to disease outbreaks. These investments in human resources for health, particularly from G7 countries, have not only been responsible for saving millions of lives, they also enable us to respond to emerging threats and to deliver new and complementary life-saving interventions to at-risk populations. Malaria endemic countries themselves have proved to be innovative in their national responses, leveraging these community health workers to respond jointly to both COVID-19 and malaria, and successfully avoiding the worst case scenario of a doubling of malaria death in sub-Saharan Africa that was projected for 2020. However, malaria infections and death will undoubtedly increase due to the pandemic, and we are still far from the finish line in addressing COVID-19. Meanwhile, the overall global resources available for malaria remain insufficient to reach global targets in 2025 and 2030, even before COVID-19. We are facing a $2.6 billion annual funding gap that holds us back from achieving a malaria-free world. In short, we are here today to emphasize that ending endemic diseases like malaria is a pathway to strengthening fragile health systems and boosting resilience to better deal with current and future health threats. Again, let me thank you for joining us today to learn more about how we work in synergy to build a more health secure world. On behalf of the RBM Partnership to End Malaria, we welcome this important effort and stand with you in cooperation. Thank you.
Thank you so much, Dr. Diallo. Now for some, there I am. Thank you very much. We're all getting, we should be used to Zoom by now, quite frankly, but I have to say when you're hosting a big conference like this, such an important conference, and lots of other people are getting involved in your options, so it's a little bit difficult, but thank you, Dr. Diallo. It's really great to hear your thoughts, and it was really fascinating to hear how you're talking about working in synergy in tackling malaria. So we really, really appreciate the important message and the time and the expertise that you've shared with us today and kickstarting this incredibly important event. And like I say to everybody watching, please do tweet about it. On Twitter, the hashtag is MalariaWinWin. Now, I promised this was going to be really interactive. And so before we hear from our next esteemed speaker, we are going to test your knowledge with a poll. So get ready for the next poll, and this time the question is, how many fevers do malaria programs prevent each year? Now, I'm sure you all know the right answer, but just in case, let's have a little go. Press the option that you think is right. Is it 25 million fevers, 50 million fevers, or over 75 million fevers? And don't worry, it's all anonymous. I will not be able to know which answer you personally have chosen, but it's just a little tester to find out. And well, 78% of you have said over 75 million fevers. That is absolutely the correct answer. It's a huge amount if you put it into context. Malaria programs are able to prevent over 75 million fevers each year. And this is really significant because preventing fevers caused by malaria from occurring, well, preventing them, that means that there's less chance that they will be confused with other diseases where fever is also a key symptom, which could, of course, be the next pandemic. So it's absolutely crucial to have proper fever diagnosis. It's vital to our global health security, and that is what prevention programs have on the ground. So a huge amount, over 75 million. We're now going to go to our next esteemed speaker. We will be hearing from the Honourable Dr. Daniel Ngamije, the Rwandan Minister of Health, who previously served as the Director for Malaria and Neglected Tropical Diseases in the WHO's country office based in Kigali. Thank you so much, Dr. Ngamije, for being with us today. I give the floor to you.
Excellencies, distinguished guests, from 2016, when malaria was at its peak in Rwanda with 4.8 million of malaria cases, 18,000 severe malaria cases, and unfortunately 700 deaths due to malaria nationwide, the government of Rwanda put in place the malaria contingency plan and deployed data-guided interventions such as indoor nasal spray, long-lasting nets deployment, home-based management of malaria cases by community health workers in all age groups. And recently, we introduced new tools and innovations such as the use of drone for larviciding, distribution of new generation of nets, PBO and G2. Furthermore, from 2021, the government of Rwanda engaged with civil society organizations to support local leaders and communities in malaria control at community level. Today, around 60,000 community health workers are deployed with at least 4 community health workers per village countrywide. And they are very key in long-lasting insecticide nets as need assessment, distribution, and to ensure effective use by the population. They are also involved in community-based integrated vector management, home base of malaria, indoor residual spray. Currently, community health workers, they detect using malaria rapid tests and treat up to 60% of all malaria cases countrywide. And as impact, we noted that 63% of reduction of all malaria cases that happened from 4.8 million in 2016 up to 1.8 in 2020. And we noted also 81% of reduction in severe malaria, all from 18,000 to 3,400 in 2020. And also, we noted 79% of drop in death due to malaria from 700 cases or death in 2016 up to 148 death in 2020. The challenge is the sustainability of community health workers' role. The government of Rwanda and partners invested in performance-based financing scheme to remunerate activity performed by community health workers. The government also supports in organizing community health workers in cooperatives to run income-generating activities from which bonus or incentives are given periodically to community health workers. We believe in this category of health workers, and we noted it recently with COVID-19 pandemic, where they were very, very helpful in home-based care of COVID-19 cases. These are among some of the vital work that the country is doing to drive malaria down cases and death and strengthen the health system to protect against future pandemics. I thank you so much.
Dr. Ngamije, thank you so much for your comments. And what is really fascinating to hear is how you talk about the community health workers, the people on the front line doing all the hard work in tackling malaria on the ground. And a little later on, we will be hearing from two of those community healthcare workers giving their experiences and sharing their immense knowledge. So thank you so much for bringing them up. It's been fascinating to hear your perspective as well. Thank you. Now, I know there's a question as to what the hashtag is, if you want to get this going on Twitter. If you follow me, I am at BBC Kasia Madera, Kasia Madera, Madera. I've been tweeting about it already. The hashtag is Malaria Win Win. So please, let's get this trending on social media. Let's get people talking about malaria, because of course it's so prevalent, it's still there. We need to get people talking about this. Right, I'm going to be quiet now because we're going to hear from our next esteemed speakers. Wendy Morton MP, the UK's Minister for Global Health Security, and also Her Excellency Marina Sereni, the Italian Vice Minister for Foreign Affairs and International Cooperation.
Hello, and thank you for inviting me to speak. I'm pleased that so many of our partners across the G7, the Commonwealth and beyond have joined this important discussion today. We are here because the situation is urgent. There are over 200 million malaria cases every year. Malaria kills more than 400,000 people every year. Each one of these deaths is preventable. Of course, COVID-19 is also having a devastating effect on malaria endemic countries. It is affecting people's wider health and well-being, their livelihoods, the economy, and our ability to tackle other crises. There is no doubt the pandemic is making it harder for countries to drive down malaria cases and limit deaths. Nobody knows this better than the brave people on the front line, who continue to risk their own health to keep others safe and healthy. Community health workers, most of whom are women, who are already juggling many responsibilities, are constantly tackling multiple crises at once. They are often the first people families turn to when they need advice or are unwell. They can diagnose, treat and care for people with diseases like malaria, as well as new infections like COVID-19. Community health workers are a critical line of defence against current and future pandemics, and a key part of any primary healthcare system. We need to invest in their potential and collaborate to support them to work effectively. There are challenges that means support needs to go beyond funding. Community health workers must have adequate training. They must be fairly incentivised, and they must feel safe and valued when they go to work every day. UK investment in the Global Fund to fight AIDS, TB and malaria has helped nearly 1 million community health workers to skill up in countries across sub-Saharan Africa. And the UK is committed in investing in stronger, more inclusive and resilient health systems, including at the community level, with the ambition of universal health coverage for every country. This will help us to be better prepared so that we can prevent, detect, respond to and recover from disease outbreaks and other health threats like drug and insecticide resistance. The UK will spend £1.3 billion on global health next year. At the forefront of the international response to COVID-19 and of wider global health issues, our investments will help keep people safe and help address a wide range of health priorities. We know that we cannot achieve our aim to end the preventable deaths of women, newborns and children without taking action against malaria. The good news is that other partners feel the same. Our allies in the G7 also have long track records of investing in global health. I know health will be a major topic of discussion among leaders when they meet at Carbis Bay later this month. Over the past decade, all over the world, people have thought carefully and creatively about how to keep essential services going, including for malaria, and then put their plans into action. Arguably, nobody does this better than community health workers, who sacrifice so much for the health of others. So at this challenging time, I invite us all to reflect on the qualities that make an excellent community health worker: courage, patience, resilience and flexibility. These are qualities to cherish as we work together to build global health security and drive down malaria around the world. Thank you.
Excellencies, dear guests, I am pleased to participate in this event and I would like to thank the organizers for the invitation. According to the 2020 World Malaria Report by WHO, actions to combat malaria over the past 2 decades have led to significant progress, preventing the onset of 1.5 billion cases and saving 7.6 million lives. However, each year, more than 400,000 people die of malaria, a preventable and treatable disease. An estimated 2/3 of deaths are among children under the age of 5. The majority of malaria deaths worldwide are concentrated in 31 countries, 6 of which are African countries. This is unacceptable. The crisis caused by the COVID-19 pandemic has represented a serious additional challenge to malaria responses worldwide, threatening to destroy decades of progress in the fight against malaria. In addition to COVID-19, conflicts and insecurity have severely damaged health facilities. This has deprived communities of basic health services and sparked emergency needs for HIV, malaria and tuberculosis treatment, as well as vaccination and safe delivery among internally displaced persons and host communities. These are the main challenges the international community has to face in the fight against malaria. Italy has supported this fight since its inception. We encouraged the establishment of the Global Fund in the context of the G8 in Genoa in 2001, and this year the fund celebrated its 20th anniversary. Our country strongly supports its valuable activity throughout the years, lastly by increasing its contribution at the Replenishment Conference in Lyon. So far, the Italian financing to the Global Fund is the single highest contribution from our development cooperation budget. Moreover, several Italian NGOs, research institutions, and academia are particularly active in the field with the communities in the fight against malaria. To conclude, let me mention that a few days ago, on May 21st, Italy co-hosted the Global Health Summit together with the EU Commission in the context of the Italian G20 presidency. On that occasion, the Rome Declaration of Principles on Pandemic Preparedness and Response was adopted. One of the most relevant takeaways of the summit is the crucial importance of multilateralism and coordination to achieve global health security and to the overall strengthening of global health architecture. The COVID-19 pandemic has revealed the interconnected nature of health security within and between nations. We must continue strengthening our health services, implementing the Rome Declaration of Principles, and maximizing the synergies with the ongoing World Health Assembly, the Italian G20 presidency, the UK G7 presidency, and all relevant international fora. Thank you for your attention.
I'd just like to thank everybody for their comments, and isn't it fascinating to hear how all our esteemed speakers thus far, Dr. Ngamije, Minister Norton, Vice Minister Sereni, have all spoken about the workers on the ground, those people on the front line. And as Minister Morton described them, the patience, the courage, resilience and flexibility that is needed in those frontline workers, health community workers who risk their lives helping people. It is just absolutely fantastic to hear from them and to hear about them, and we will be hearing from them in just a moment. So it's great to hear such strong commitments and strong remarks from Rwanda, the UK, Italy, all those countries continuing to invest in tackling diseases like malaria, seen as a central pillar of efforts to build global health security and also pandemic preparedness. As I say, we will be hearing from our esteemed panel in just a moment, so please do get yourself familiar with that Q&A tool in the Zoom workshop that we have, in the windows that you have, and don't forget to tweet. I'm seeing lots of interaction already, so that's fantastic. Hashtag malaria win-win. Let's get this event trending. So before the panel, I did promise a very interactive session. Before the panel, we're going to run another poll. So here's the question for you. How many fevers have been tested for malaria since 2010? Is it 1 billion? Is it 1.5 billion? Or is it over 2 billion? How many fevers have been tested for malaria since 2010? Now, you're all far more tech savvy than me, so please do press the answer that you believe is to be correct, and we'll have a look at which answer you think is right. How many fevers have been tested for malaria since 2010? 1 billion, 1.5 billion, or is it over 2 billion? 79% of you have got the answer absolutely spot on. It's a staggering amount of fevers tested for malaria since 2010. But of course, we always have to remember the people who have lost their lives to a disease that's mainly, predominantly children. So we must always bear that in mind. But excellent work from the people on the ground. Over 2 billion fevers tested for malaria since 2010. And why is this significant? Well, it's a huge testament to what malaria programs have achieved over the last decade, from the scientists who are developing the diagnostic tests to the community health workers who we've been hearing so much about, who are carrying out those tests in the right place at the right time. We salute you all. So we're going to move on to our panel discussion now, where we're going to hear more about how we can continue to build on these successes to improve pandemic preparedness. Make sure you get your questions ready. I want this to be as interactive as possible. No one wants to hear from me. We want your questions to our incredibly experienced panel. To start things off, we are going to hear from Dr. John Nkengasong, the Director of the Africa Centers for Disease Control and Prevention, who has prepared a message for us.
Greetings from the Africa Centers for Disease Control and Prevention, based here at the headquarters of the African Union Commission in Addis Ababa, Ethiopia. I would like to thank Malaria No More UK and international partners for this opportunity to speak to you all today on the important matter of tackling malaria, a win-win for saving lives and preventing future pandemics. There has been great progress made in the fight against malaria through testing and treatment programs. In fact, since the year 2000, 7 million lives have been saved due to efforts from international organizations, such as Malaria No More and national interventions. These efforts were focused on strengthening health systems, particularly at community level, and ensuring access to malaria testing and treatment at the last mile, mostly in rural communities. However, COVID-19 pandemic has led to disruption in numerous public health services, including malaria services. A recent report by the Global Fund shows the pandemic has impacted life-saving malaria programs and health services across 32 low and medium income countries in Africa and in Asia in 2020. For example, across African facilities, malaria diagnosis fell by 17% and malaria treatment fell by 15% compared to the same period the previous year. Additionally, 21% of facilities were stocked out of the anti-malaria medicine doses for children under 5 years of age and reported a dramatic drop in case management of malaria, meaning there could be a real risk for a spike in mortality. Anecdotal evidence also showed that the excess non-COVID-19 deaths resulting from service disruption may be greater than COVID-19 related deaths. In the long term, disruption of services and weakening of current health systems could lead to increase in mortality and reversal of the progress made so far in the fight against malaria. One of the biggest lessons learned from the COVID-19 pandemic is the need for Africa to build and invest in its own health systems. Africa needs to strengthen its own health systems to prevent them from collapse when faced with future health threats, such as the COVID-19 pandemic. Community health workers can help to transform the interface between public health services and communities. For example, the 2014 Ebola and 2015 Zika epidemics demonstrated how community health workers contribute to preparedness in 3 ways. Firstly, increasing the access to health services and products within communities. Second, communicating health concepts in a culturally appropriate and sensitive fashion. And thirdly, reducing the burden felt by formal healthcare systems. Despite the importance of community healthcare workers to health systems in resource-constrained environments, more needs to be done to increase the number of community health workers in support of preparedness and response. In response to these workforce development gaps, the African Union Commission launched an initiative in 2017 to deploy 2 million community health workers across the continent. Africa CDC has deployed over 10,000 community care workers in over 21 countries to support the COVID-19 response. Building and investing in community health systems is therefore extremely important in fighting malaria. This COVID pandemic, as well as other emerging and re-emerging diseases on the continent, to ensure and maintain our health security. By strengthening health systems, especially at the community and local levels. The Africa CDC and the African Union Commission call on G7 leaders to use the upcoming G7 summit in Contour to scale up support for community health systems in low-income countries as a shared health security priority, and recognizing their importance and effectiveness to ensure our health and economic security. I thank you for your attention and thank you for giving me the opportunity to have this conversation.
Our absolute thanks to Dr. Nkanga Song for his words and for once again referring back to the community healthcare workers who are on the ground, on the front line, who are working tirelessly. And as we heard there, the kind of cultural recognitions that make it possible for them to reach those people who really, really need it. These people are on the front line, which means that they are doing a tireless job, and we thank them absolutely for it. And it's interesting to hear that there will be calls for the G Summit to scale up their support for those community healthcare workers. So now, without further ado, I'm thrilled to introduce our expert panel. Please welcome the following. Ellen Konoma Amoa, a community health worker at the Anglo Gold Ashanti Malaria Control Program in Obaesi in Ghana. Now, Ellen has worked herself as a frontline community health worker and a midwife for 9 years, so we're going to really benefit from her experience. Dr. Thomas Brewer, Senior Vice President, Chief Medical Officer at GSK Vaccines. And Dr. Brewer leads the Global Medical Affairs Organization, which includes global health activities and COVID-19, of course. We're also thrilled to say Rachel Banda Mukande joins us, a community health worker at the Mapalo Clinic in Zambia. Rachel specializes in infant and young child feeding and integrated community case management of malaria and other diseases. And she's been serving her community for 10 years. So we're very grateful to her. Dr. David Reddy, CEO of Medicines for Malaria Venture, which is a leading not-for-profit product development partnership in anti-malarial drug research. And Dr. Reddy has over 25 years experience in the development and the commercialization of medicines for the treatment of infectious diseases. Also on our panel, we are joined by Stephanie Seydoux, who was appointed the French Ambassador for Global Health in 2018. And Stephanie represents France in various international organizations, currently active in the French multilateral response to the COVID crisis. And also joining us, Dr. Stephanie Williams, appointed as Australia's Ambassador for Regional Health Security, Department of Foreign Affairs and Trade back in March 2020. Dr. Stephanie is supporting the advancement of Australia's interests in the Indo-Pacific region. A very warm welcome to our esteemed panel. We have lots of questions coming in for you already. And don't forget, everybody who is watching, you can also get involved on social media. The hashtag on Twitter is MalariaWinWin. Now, I want to start with our community health workers. Ellen, I'm going to put this first question to you. We've been hearing so much about the patience, the resilience, the hard work that you've been doing. And we learned from our poll that over 2 billion fevers have been tested for malaria since 2010. Many of those by community health workers such as yourself. Ellen, would you just tell us a little bit more about your experience on the front line as a community health worker? What does your work entail?
Thank you very much for this opportunity given me. As a frontline health worker, as a community health worker, it's a little bit challenging, especially in our settings and in our part of the world, when it comes to community-based treatment. In underdeveloped and developing countries, you face a lot of challenges due to some traditional, some orthodox beliefs that we know. So my work entails taking care of pregnant women, taking care of children under 5, and other ill health. So on a daily basis, I attend to pregnant women, and as part of malaria prevention for them, we give them malaria prophylaxis, that is IPT, when they come for antenatal visits. And then in the community on children under 5 too, we give them malaria prophylaxis. Sometimes there are, in other parts of the region, there are seasonal malaria chemotherapy that are given to children under 5 to prevent them from malaria. So on a day-to-day basis, when the pregnant women are seen, they are given malaria prophylaxis starting from the early 2nd trimester. And then they take it through on a monthly basis through till they are term. So when it comes to children too, we give them the prophylaxis 3 times in a year, especially in the northern region. In some parts of the northern region, the chemotherapy, seasonal chemotherapy are given to them at from July to October to prevent them from malaria diseases. And we know that malaria accounts for most deaths, most hospitalized deaths when it comes to children. When children are hospitalized, malaria accounts for most of their reasons for being hospitalized. And about 3% of all cases, about 80% of all cases that are seen are malaria-related issues. And then also, as part of the malaria preventive treatment, we do indoor residual spraying, which is done in almost about 16 districts in the region, 16 districts in the country. And it helps a lot. It helps a lot to prevent malaria. But because we have to, there's something that we have to do to extend it more so that a lot of people will benefit from this indoor residual spraying, which is a seasonal thing that is done. So basically, on a day-to-day activity, when it comes to children, they are seen with fevers and you treat them. When you go into the community, some of these kids, because of financial constraints, their parents are not able to bring them to the health facility for further treatment. So you treat them and then you test before when they are positive and then you treat them. So sometimes you give them treatment, something like a basic treatment that you can give them in the communities. But when you test and then you see that the fever and other things are, other symptoms are getting higher, you have to refer them to the facility for further treatment, to do the microscopy, and then they give further treatment. Because some of these malarias end up in severe malaria, which also has other disability and that the children are encountered with.
Rachel, thank you so much. I'm a little bit worried that we've lost your screen, but we've got the gist of what you were saying, and it's fascinating to hear how it works on the ground. And sadly, once again, we're hearing that it's children at the brunt of this, as we know with malaria. Ellen, thank you. Rachel, I'd like to bring you in, seeing as we've got your expertise from the Palo Clinic. I wonder if you could just give us an explanation of how COVID has impacted upon your daily work now when it comes to dealing with malaria, which already takes up so much of your time, Rachel. How has COVID impacted your daily work?
Can you please come again? I didn't get that.
Ellen, I'm thanking you for your incredible insight, and I'm just going to bring Rachel in now. If we can bring Rachel in and unmute her microphone. Rachel, how has COVID worked out for you in terms of your daily work?
Good afternoon, thank you. COVID-19 has really affected our work as community health workers here in Zambia, because mostly the parents, they are not bringing their children to the health facility. Hence, they just come to us as community health workers. Before COVID, we used to see between 7 and 10 kids per week. But now we are seeing over 15 to 20 children per week. And with this, we also have a challenge of shortage of drugs. Some children who come to us, when we test them, we find that they have malaria. When we have drugs, we treat them right away. But sometimes when they come to us, it's found that we have no drugs to give them. So that's also a challenge. Then again, parents are refusing to go to the nearest health facility, even if you send them to go there, because they are scared of catching the COVID. Hence, once they come to us and we don't have drugs, they prefer going back home than going to the health facility. So also the distances covered here in Zambia to the health facility, it's also a challenge. So these are some of the challenges we are seeing. So the percentage of children coming to us weekly has gone up as compared to way before COVID-19 broke up.
Rachel, thank you so much. Let's bring in Stephanie Seydoux now, because Stephanie, we've been hearing about the invaluable role that people like Ellen and Rachel play, the community health workers who are on the ground, who are responsible for detecting and responding to fevers. Talk us through how we scale up and how we strengthen this front line of defense. What role is France playing? What are you hoping from the G7, which is upcoming?
Thank you so much for the great question and the great interventions. Well, I mean, I see that there are maybe three main points. One is sustainable funding, and it is absolutely key. And this entails sustainable funding for health systems, strengthening in international security, a global approach. This is key because as we finance sustainably health systems, i.e. Access to health for everyone, this will provide long-term financing to give community work the value, the security and the predictability that it needs. We've seen indeed that the contribution of community health workers is essential and deserves this predictability and perspectives and stability in financing going forward. The second point is to, and in malaria it's particularly the case, obviously, is to remove the structural barriers that prevent the elimination of the disease. Sorry, it's very noisy out there. Well, there is great importance to fight poverty-related discrimination, gender inequalities, the exclusion of people living with malaria. And we've seen that in that respect, the role of community work, which is frontline work, is absolutely key. An example, when we will beat malaria, when mothers have better access to clear quality information about malaria so that they know the symptoms and can spot they can spot them in their children, and they will know the options for preventing the disease. And this is clearly linked to the development of community health systems. And finally, about how can G7, G20, WHO, Global Fund do more? Well, just a very short word to say, to recall the absolutely crucial support that multilateral funds have brought to this issue, together, obviously, with governments, national governments. And well, France has been a long-term supporter of these multilateral funds, notably the Global Fund against HIV, TB and malaria, as well as UNITAID, but also the WHO. We know malaria well, we know it's a priority. Some of our overseas regions suffer from malaria, and many African French-speaking countries are also regions which fight this disease. So we are very involved in this fight. And so we believe that the role played by the key multilateral organizations has to be upheld, reinforced going forward as part, and that will be my final word, as part of the global health agenda. Malaria and fighting malaria is part of the global plan for health security, together with fighting the other two big pandemics, TB and HIV, and also because it relies, as we've said before, on strengthening health systems, which is our best defense against the next unforeseen pandemic. So we really believe that it's this global connection which G7, G20 can make between this global issues in the global health agenda. Thank you.
Thank you so much. There's a lot to pick up on, and we'll pick up on loads of those threads that you've shared with us, Stephanie, but thank you for the time being. Let's bring in Dr. Reddy right now. Dr. Reddy, when it comes to product development partnerships like your organization, like Medicines for Malaria Venture, in terms of developing new tools and ensuring that they get out as quickly as possible to those that need them. How do you do that? And what are the things that you are looking out for? And I wonder, we've had a specific question regarding vaccines, where we are with that. Is that something that you could also thread through in your answer?
Thanks very much. Yes, listen, firstly, I'd like to say that just the product development partnerships like MMV were formed to overcome market failure. That was a lack of incentive or commercial incentive to invest in malaria R&D. In terms of the focus, the first thing I need to do is thank Alan and Rachel for everything that they're doing, the community health workers. And they talked about a range of activities that they implement day in, day out: vector control, administering drugs for prevention, taking patients to referral centres for the management of more complicated malaria. As product development partnerships, our job is to provide the interventions that they need to do their jobs day in, day out. We focus on addressing the key patient and programmatic needs, and we work in partnership to catalyze and support R&D that can bring these through. And we manage portfolios of potential projects that could bear fruit. And our job is also to ensure that we invest in the ones that are going to have the greatest impact and also have the highest probability of success. In the case of MMV, we've developed 11 medicines to date. Hundreds of millions of patients are being cured already with these, and around between 2.5 and 3 million lives saved. And that's including with the first pediatric ACT. But it's really important to say that the job doesn't stop here, because our programs continue to advance and change, but equally the parasite is evolving, and we see resistance to insecticides, in fact, also to tests and to drugs. And this is increasing right now in Africa. So we do need, and we continue to bring forward the next generation of compounds. Also, there are needs of special populations like pregnant women who are really underserved now, and they need safe and effective treatments that they can take to manage malaria and prevent malaria. And just another consideration is that these compounds we develop, they aren't medicines until they get into the mouths of the patients that need them. And that requires efficient manufacturing, affordability, and access. And part of our job is also to ensure that these elements are in place and that we can then build upon the excellent work that's being done by people like Alan and Rachel to share best practices and advance the cause and advance the progress. Specifically with regards to the vaccines you mentioned, so there is one that is currently being, is an implementation phase. That's the GSK RTSS vaccine. There are studies looking at that in combination with other interventions. And so that is already beginning to have a place in the control of malaria as we move ahead. And you saw, I think, the very promising results coming out on a new vaccine candidate, the phase 2 results that are alluded to here, that had 77% efficacy in the smaller phase pilot studies. These are now going into larger phase studies. And I think what we all look forward to is seeing the data come out across different populations who could benefit from that and in different settings. So we know exactly how we can slot that into the armamentarium we have. So it's great progress. There's a lot of cause for optimism, but a lot of work to be done. Thank you.
Thank you so much for your answers, and thank you as well. I think we all echo our thanks to Ellen and Rachel, who are just tirelessly working to help people on the ground. Our thanks, and Dr. Reddy, thank you for also talking about answering that phase 2 vaccine that is showing 77% efficacy. So I hope that answers one of our questions. The name of our question giver has just escaped me from my screen, but I hope that's okay. If not, just get back to me. I mean, Dr. Reddy mentioned GSK, and seeing as we've got Dr. Brewer, the Senior Vice President and Chief Medical Officer of GSK Vaccines, let's bring you in now, and you can talk us through what GlaxoSmithKline is doing to tackle malaria.
Okay, so thank you, and thank you to have mentioned already the malaria vaccine, which is currently in a pilot phase in Africa, which is coordinated by WHO and obviously the countries involved. So GSK is essentially building on innovative tools. So we want to make whatever we have in the company available to global health, vaccines and medicines. And we are essentially guided by 3 pillars. Whatever we do should be science-led, but it should also be sustainable for the world, but also sustainable from a GSK point of view, and obviously focused where we have the biggest impact. And the malaria vaccine is actually a very good example to exemplify this. So the malaria vaccine, which was just mentioned, took over 30 years to develop in partnership with PATH and others. And it's now the first malaria vaccine which shows a significant efficacy, not as much as we wish, but significant efficacy against the deadliest malaria strain, Malaria falciparum. But GSK is also active on the pharma side. So together with the Medicines for Malaria venture, we have developed tafenoquine, which is the first single-dose treatment for the radical cure of another strain, Plasmodium vivax, which has received market approvals in several countries. And with additional studies, we have worked on pediatric regulatory approval, and if approved and followed by review of WHO, this would be also the first one which would specifically be used in children. However, we are not stopping here. We have innovative activities ongoing in our R&D center in Tres Cantos in Madrid, where scientists work on new promising assets against malaria and TB. And maybe another thing to mention, we also collaborate across different companies. And just one example, in January 2021, GSK and Novartis partnered to launch the project called Africa Gradient to support high quality scientific research investigating the link between genetic diversity across different regions in Africa and its potential impact on response to drug therapeutics for malaria and TB. However, we know that without helping to unlock barriers to access, these medicines and vaccines won't reach the underdeserved. I always say for vaccines, there's a difference between vaccine and vaccination. So if you don't get vaccines into arms, nobody is helped. So we are working together with NGOs like Save the Children, AMREF, and Comic Relief and others to contribute on that aspect as well. And maybe to close, again, another project with AMREF Health Africa to address malaria and TB in Ethiopia and Kenya has recently been announced. The program aims to sustainably strengthen health systems by building the capacity of frontline health workers and health managers and strengthening TB and malaria surveillance to inform decision-making. And maybe one last word on the new and exciting news about a second malaria vaccine, which is still many years away from potentially make it to markets. GSK obviously highly welcomes more than one malaria vaccine because malaria vaccines are one tool next to medicine, bed nets, and all the other things. So thank you for now.
Thank you so much, Dr. Brewer. And that, again, we're hearing that idea of getting vaccines into arms as being a priority. So it's something that we've heard before, and we really appreciate your time. Let's bring in Dr. Stephanie Williams as the Australia's Ambassador for Regional Health Security. I know, Dr. Williams, you've been working in supporting the advancement of Australia's interests in the Indo-Pacific region. And I just wonder if you could just share some of the lessons that can be learned from the Asia-Pacific region on the front line of health systems which are needed to respond to new and, of course, existing diseases such as malaria.
Thanks, Kasia, and thanks for the opportunity to join the panel today. And I think when we reflect on lessons we've learned in the region from new and emerging diseases, I think that's been summed up really well in the Global Preparedness Monitoring Report, which is the two top ingredients for successful responses are political leadership and empowered and engaged citizens. Leadership that makes decisions based on evidence, that's empowered to act decisively within health systems on acute as well as chronic infectious diseases, or longer term. And what we see in the Asia Pacific region, and what we've learnt from Australia's Centre for Health Security, which is an initiative designed to improve country capacity to detect, prevent and respond to infectious diseases, and we take an integrated view, an inclusive view of infectious diseases, is that we need those integrated systems for infectious disease resilience. And our malaria and TB partnerships, for example, and I know we're talking about malaria today, working in Southeast Asia and in the Pacific, we're able to pivot for direct COVID response, making direct contributions to countries' own responses to COVID by virtue of the hard work that's been put in over years in developing some of those core common platforms, point of care diagnostics, improving laboratory skills in molecular diagnostics, having systems for sentinel surveillance, and having the practice of using information for action, surveillance systems that inform local, regional and national decision making. I think when we look at how we approach that in the region, and of course others have made better points around people and community health workers at the forefront of the humans of delivering that care. And from the perspective of seeing where we have the opportunity for those integrated capacities and systems and skills that can be built that complement both the diseases that threaten lives every day and have done for decades, and the diseases that will emerge in the future, like the COVID pandemic, the next emerging infectious diseases. So really searching for that commonality of where we can exploit strengths in a shared fight against improving all resilience against infectious disease.
On mute. Thank you so much. Fascinating insight and a fascinating first few answers from all of our esteemed panel. We've got lots of questions, and I want to bring Ellen back in on our question from an anonymous attendee who's not giving their name, but they ask, Ellen, this one is for you. How can we as partners support your work on the ground? And they also ask, do we need to do more to ensure the supply of tests and treatments, or more to ensure everyone has access to affordable healthcare, or both? So basically, Ellen, what more could these partners, you've got their ear, what more could they be doing?
So, as part of the support, I believe in coordination. There should be global coordination, as in monitoring, evaluation, and reporting. So when the work done on the field is being monitored and evaluated and reported properly, these challenges that we are seeing can be supported globally. So for instance, when we are talking about shortage of RDTs, we get the numbers. For instance, in a week or on a monthly basis, we see more than 800 cases of malaria in the facilities. And out of this 800, about 80% of them are children under 5. And out of this 80% who are malaria positive, you get about 70% or 50% of that 80% who end up with severe malaria. And severe malaria also comes with a lot of complications. Some are being referred to other bigger facilities. So when the supports come, you are able to test them, get more results, and then treat them appropriately.
Thank you. So it's all about the support and backing you guys up. Thank you so much. And it's absolutely crucial. And I hope everyone's listening, all the partners. We've got a question for Stephanie Seydoux. When it comes to France, the questioner asks that you highlighted the key role that the Global Fund to Fight AIDS, TB and Malaria is playing in fighting existing diseases. They'd like to know how the French government is supporting this key institution to ensure an ambitious settlement at the 7th replenishment next year. Stephanie, if you'd like to pick that up.
Well, thank you very much. no, France is a staunch and historic supporter of the Global Fund ever since it was created. We were the host of the 6th replenishment, which was successful with $14 billion gathered. And it's a good thing that the target was reached, because little did we know that a few months later, COVID was going to hit the planet, and that indeed the solid replenishment would definitely help comfort governments' policies in tackling the 3 pandemics, as well as strengthen their health systems as a very important line of defense, while having to respond to the pandemic on the other hand. And as other speakers have said before, and particularly Stephanie Williams, a lot of what the COVID response was able to build upon were indeed programs which had been built through the fight against the 3 diseases that the Global Fund had massively contributed to. So this is the logic, and France will definitely and remains a very strong supporter of the Global Fund. We're definitely going to be there for the next replenishment, which will be under another host country's, let's say, patronage. And in the time being, we are very involved in the discussions which are taking place right now regarding the strategy of the Global Fund going forward with other board members. And in this area, in this framework, we support very, very, very strongly the orientation towards strengthening health systems and indeed community health. Let me just say one word to say, and that is moving one step from the question on the Global Fund, that in this respect, we're all in favor of well, getting governments to indeed recognize community health, as well as in general the value of healthcare. And we are launching an initiative which will be set in the framework of the Beijing +25, the Forum Generation Equality, taking place in France with UN Women at the end of this month. Valuing and giving what the initiative is indeed about, gathering as many commitments as possible to support healthcare workers who are 70% women, in order to achieve this triple dividend of better care, better equality for women, and development also outcomes. We do believe that multilateral organizations such as the Global Fund, but others as well, have a role to play in this respect, and that as this debate has illustrated, we see that with the case of malaria, how important this frontline is, and how much it is important also that the right level of investment, recognition, and security is given to community health and community health workers. Thank you.
Stephanie, thank you so much. Thank you so much. And it's great to hear that you're looking at better equality for women. That's always an important one, because as we all know, the healthcare workers on the ground tend to be predominantly women. So thank you. Let's just go. We've got a question from Tony Mugasia, and I'm going to offer this to you, Dr. Reddy, please. And I just want to say, we've only got about 10 minutes or so left. So if I could ask you to keep your questions short, so we can get through a few more, because I've got lots of questions for you guys. But Dr. Reddy, Tony Mugasia asks, how has COVID-19 impacted the global supply chain of malaria commodities and diagnostics to sub-Saharan Africa?
Okay, thanks a lot for the question. I think one of the biggest challenges was the lack of access to personal protective equipment. That being said, WHO Global Malaria Program gave really good pragmatic guidance on how to continue programs in the face of COVID-19. They also convened partners, including Global Fund, President's Malaria Initiative, the Gates Foundation, and others, to during the pandemic to look for potential supply issues and to troubleshoot them. And through that, we were able to minimize most of the disruptions that could have occurred. That being said, it was challenging in some areas for bed nets particularly, and also for rapid diagnostic testing. And this really points to some of the fragility of the global supply chain and the need to think more carefully about national manufacturing in the regions where those commodities are needed. Thanks.
Thank you so much, and thank you as always for keeping it brief, because we've got so many questions coming through. So let's go to now Dr. Williams. Can I bring you back in and ask you about what steps your government is taking to ensure that community health investments, including of course malaria programs, are embedded in your health security strategy, and also your response, Dr. Williams?
Thanks for the question. So we have the principal way, if I'm going to describe the two priorities of how Australia invests in health, it's under the goal of universal health coverage and in pursuit of global health security. And in country contexts, we are very focused on, as Stephanie Seydoux mentioned before, the ingredients for health system strengthening, which is appropriate to context from primary care to community care. So really, as a health development partner, we take a very integrated approach to country priorities and work within systems with budget support, project support, as a bilateral partner, as well as making regional specific investments in malaria. We're a proud partner with MMV, for example, and FIND, as well as globally. So really we see the need for country tailored support, specific regional and thematic investments, and being part of the global partnership and efforts described here today.
Fascinating to hear partnerships working together and that you're all talking together. That's excellent. Thank you so much. Rachel, I'd like to bring you back in as somebody on the front line who really understands what is needed. A question has come in for you asking, what are the benefits? Could you talk us through the benefits of training someone already in the community instead of, for example, Rachel, hiring medical staff that are already trained?
The benefits of training someone in the neighborhood would cushion the way people come to us. If we train someone, then some people will be coming to us, then some will be going to other people who are also trained. But it's difficult to train more community health workers. So if more community health workers can be trained, then these people, the parents who are refusing to take their children to the clinic in fear of COVID, can go to other community health workers and access the medicines. Because most of the time when they come to us, like myself, I run out of drugs, hence they go back. So if more community health workers are trained, then it can cushion the impact of people keeping their sick children at home. So there is really need of training more community health workers. Thank you.
Thank you so much, Rachel. That's excellent. Thank you so much. We have a question now for Dr. Brewer. From your work with organizations like AMREF, what has GSK found to be the most effective way to support and strengthen community health systems, Dr. Brewer?
I think it's always a combination to translate our science into medicine or vaccines, which can then be implemented. That's a more long-term view, but will have the greatest impact once implemented. And again, the malaria vaccine, which is currently in pilot testing, is one aspect. But then different companies, among them GSK, obviously, finding innovative ways to support healthcare workers on the ground. And I mean, GSK is highly appreciative what is happening. And obviously we can only contribute on a small basis, and it needs the entire community to strengthen local forces. But as I said before, industry can have beautiful medicines and vaccines developed. If they don't find it onto the ground, there's little value of this. So a combination of both is the way forward.
Okay, thank you so much. And we've got one from Anders Bjorkman, and I wonder, let's get someone from a government. Stephanie Seydoux, if you would tackle this one for us. Anders asks, why does it appear possible for the global community to gather billions of dollars worth of funds, $30 billion worth, Anders says, for COVID vaccines, but it's hard to gather $3 billion for global malaria control? What's your assessment of that?
Well, we must absolutely use this precedent in global mobilization to indeed, well, set the priorities, all priorities higher up on the agenda. That's what I was alluding to before. What we see with the pandemic is the absolute need for investment to come up at the right level and at the right time. And this is, in a way, what the COVID response set into motion. Now, not to say that there wasn't enough investment in the fight against malaria, for example. I alluded to the last replenishment of the Global Fund, which remains, and other key multilateral institutions. Regarding innovation, well, this is certainly an area where we have to build on this capacity which the international community has shown to mobilize strongly and rapidly in favor of what is really needed in order to do the same for other priorities. And we're talking here about malaria, of course, but there are other diseases where indeed with well, a little additional funding, let's say, could bring us a long way in terms of achieving innovation. So there's definitely a very big case for advocacy, which can be now used to the full in order to indeed make health in general a global aim, with all priorities reinforcing each other, and not a case of some investment going in some direction and being taken away from others, which is, by the way, a position that France took from the beginning, that the fight against COVID should absolutely not give way to an eviction effect, bringing money away from other priorities, health or otherwise, in development. Thank you.
Thank you so much. And we've been talking about this idea of global coordination, but I wonder, Dr. Williams, if I could get your thoughts as we start ending our conversation here. How do we ensure global coordination in strengthening these community health systems to tackle disease and to prevent future pandemics? What can organizations like the G7, the G20, the WHO, the Global Fund, what more can they do?
I think the effort for global coordination is driven first and foremost by the demand from member states, from countries, from people in countries themselves, expecting more from global organisations, including through coordination. I think the second point I'd make is that these multilateral organisations and groupings must exploit their advantage, but play to their comparative advantage, whether it be convening, resource mobilisation or doing. And especially in a pandemic era where we have a singular focus, I see there's a real temptation for a crowded space for solutions, and clear thinking around strategic advantage and what is absolutely necessary in a time of change is really tough. But that's what I would be calling on the global bodies to be thinking about: scope, agency and advantage in their contribution to the solution. But I think the point I would re-emphasize would be demand has to come from countries themselves.
Thank you. And just as a final thought, Ellen, if I could bring you back in as somebody who is on the front line, the message in a sentence or two that you want every one of us to take away from today's conference would be?
Well, thank you very much. I want everyone to know that malaria is a win-win. We must kick out malaria. And if we are really determined, we can really do it. We can do it because we have the means. And having the means doesn't mean there are resources available, but with support from other countries, with support from the globe as a whole, if we come together and we are determined to let malaria out, we can do it and do it well. Thank you.
Ellen, thank you so much. And I think if that's the message that we all take, we can kick malaria out. We have to work together. I would like to express my absolute thanks to our esteemed panel of guests for sharing their expertise and their time. Ellen Konoma Amoa, Dr. Thomas Brewer, Rachel Banda Mukandi, Dr. David Reddy, Stephanie Sedu, and Dr. Stephanie Williams. Thank you so much for being part of this discussion today, for sharing your thoughts on this important topic, bringing your expertise, and most importantly, bringing your solutions as well to something that is an ongoing problem with children, of course, at the very forefront of this. Thank you so much for your time. Now, I'm pleased to introduce the final elements of today's conference. And once again, I do urge you to get this trending on social media, on Twitter. I haven't checked in the past few seconds, but the hashtag is malaria win-win. We can win it. We can, as Ellen said, kick it out. So now, without further ado, I'm pleased to introduce to you Peter Sands, the Executive Director of the Global Fund to Fight AIDS, TB and Malaria. Peter Sands has, of course, been the Executive Director since 2018. Previous to that, he was a research fellow at Harvard University, dividing his time between the Mossavar Rahmani Center for Business and Government at Harvard Kennedy School and the Harvard Global Health Institute. He has done so much that I will not go into his full biography because we'll be here for the next hours and hours. Peter, please take the floor away for the final remarks for today's conference.
Thank you, Kasia, and thank you to Malaria No More for hosting today's session. And I'd also like to thank all the previous speakers and the panelists for such a rich and interesting, insightful discussion about where we are in the fight against malaria. And I would like to actually start my comments with where Ellen actually stopped, where she was talking about the imperative to kick malaria out and the fact that we can do it. And I want to reinforce that point, which is that we do actually have the tools. We have proved that we can eliminate malaria. And to some extent, what's constraining us from actually finishing the job is political will and resources. We have to decide as a global community, as national governments, and within those countries, communities, that we want to get rid of malaria. And unfortunately, in many places, the communities are absolutely doing their best to do so, but haven't been given all the tools and resources to make it happen. And I hope we take COVID-19 as a catalyst, in a sense, to rethink the notion of what is possible and the speed with which we can achieve things. COVID-19 has shown that we don't have to wait years for the latest innovations, vaccines, diagnostics, but we can get them much faster. COVID-19 has showed that we can mobilize extraordinary levels of resource when the world really wants to. And it's also shown that we can act as entire communities to get rid of, tackle an infectious disease. I'm not pretending that everything with COVID-19 has gone well. Indeed, we are I would say we are halfway through the battle against this pandemic, but it has galvanized science, innovation, and partnership in a way that I think we should draw on as we think about the next phase of the fight against malaria. The Global Fund is acutely conscious that we have a particularly critical role and responsibility in the fight against malaria. We provide 56% of all funding, not least because of the generous support of countries like Australia and France. And that means that if we're going to win the fight against malaria, the Global Fund has to do its job well. And I'd like to sort of bring us back a bit to 18 months ago, because I think it's important to recognize how dramatically the world has changed. In January 2020, we were, as Stephanie Sidhu mentioned, in a sense, celebrating the success of the replenishment hosted by President Macron, where we raised 14 billion. And that was enabling us to do country allocations for malaria that were on average 23.4% up on the previous cycle. And across the malaria community, we were excited about the prospect of really stepping up the pace, of enhancing vector control, of strengthening support to communities and community health workers to enable effective case management, to really accelerating in those countries that were near to elimination to making that happen and ensuring it was sustained. Now, of course, COVID-19 then happened. And COVID-19 has been enormously disruptive, and various people have referred to the impact. I mean, one set of data that I find quite useful is we did some spot checks across 502 health facilities in Asia and Africa. That showed, and this was during April to September 2020, and that showed malaria diagnosis falling by 31% compared to the same period the year before, malaria treatment falling by 13%, and shortages in, particularly in Africa, of anti-malarial medicines, ACTs and so on, in up to 20% of health facilities. So we faced a real challenge. But I would say that I think the malaria community has responded incredibly impressively, and particularly those like Ellen and Rachel right at the front line, in lots of adaptive, creative, determined ways to ensure that we adapted the way we did bed net distribution, adapted the way that case management happened, found ways of dealing with some of the disruption to supply chains. Did it all work perfectly? No. Have we had some damage to the progress on both vector control and case management? Absolutely. We have to recognize we have lost some of the progress we've made. But I think it could have been a lot worse. And I think it's testimony to the courage and determination of people, particularly at the national and community level, to protect the gains and to protect the people at risk from malaria, that it wasn't much worse than it has been. But now we face a kind of different challenge, which is to sustain the momentum and to sustain the gains at a time when COVID-19 is dominating the health agenda, both at a global level and within countries. And this isn't easy. There's competition for resources, and I don't just mean money. Community health workers are seen quite rightly as playing a critical role in the deployment of vaccines for COVID-19. My question then is, well, when they're doing that, who's doing the case management for malaria? The sick children don't kind of wait until the COVID rollout. So we need to ensure that the way the COVID response is managed also enables continuity of delivery of essential life-saving malaria services. Also, out of the COVID-19 crisis is there's a fundamental rethinking of global health priorities going on. And we need to ensure that the fight against malaria is not lost or deprioritized in that rethinking of global health priorities. Many people talk about pandemic preparedness and so on, and contrast it to the endemic diseases of HIV, TB, and malaria. I always point out that they're endemic by choice. They're not intrinsically endemic. They're endemic because we haven't finished the job. HIV, TB, and malaria were all once pandemics. Indeed, malaria is arguably the oldest surviving pandemic that humanity has faced. And my argument here is that as we rethink the world's attitude towards pandemics and the threat they pose to human life, to societies, to economies, let's not just make it be about pandemics that threaten people in rich countries or the next pandemics that are around the corner, but let's include the pandemics that cause such loss of life and economic hardship in the poorest countries in the world, and the pandemics we haven't finished the fight against. And that's a moral argument, but it's also a really practical argument, because the things we do to fight a disease like malaria are the things we also need to do to make us safer from future pathogens. Train, equip, and support community health workers, provide diagnostic and treatment services at the rural level, at the village level, provide disease surveillance that enables us to see and detect unusual patterns of disease and respond to them quickly. These are all things that are intrinsic to combating malaria effectively, but also intrinsic to combating any future pathogen. And that's where the interplay of the health systems are so crucial. We've seen countries leverage their malaria infrastructure and capabilities to fight COVID-19. We also have some huge opportunities to learn from the COVID-19 response. I've mentioned the speed with which innovations actually get to the people who need them. I also think there are lessons about the power of daily data, of knowing how many infections and deaths there are in terms of mobilizing attention, political action. And I also think that COVID-19 has catalyzed a degree of partnership among global actors that we haven't seen before and that we should leverage in the fight against diseases like malaria as well. So I really appreciate the richness of the discussion today and the sense of commitment and urgency. I do want to ensure that we must ensure together that as the world resets its agenda and priorities in the wake of COVID-19 for global health, that malaria is right up there as a priority, and not just one where we look to have a sort of a trajectory of reduction in infections and deaths, but where we really look to making real the objective of ending malaria by 2030. Thank you.
Peter, thank you so much. And as Peter was saying, the tools are there. We just need the political will to ensure that the tools get to the communities that need them. Peter, thank you. The work of the Global Fund is absolutely central to the continued fight against AIDS, TB, and of course malaria, and the strengthening the community health systems that enable us to fight COVID and any future pandemics, as Peter was saying. It will be vital to ensure that donors fully fund the Global Fund for its 7th replenishment round next year. Now, I just want to thank all of you who joined us today and took part in today's event. You had some fantastic questions, far better than the ones that I could have thought up. So thank you for sharing them. Thank you for putting them to our incredible and amazing panel who have been working in the field of malaria. And thank you for them for sharing their thoughts on the importance of malaria investments for global health security. And a huge thank you to Ellen and Rachel for the tireless work that they do. Share your support. Hashtag Malaria Win-Win is the hashtag on Twitter. Share it, talk about it. Any questions that weren't answered, put them on that hashtag. We'll try and get back to you. Malaria No More are calling on G7 leaders as they gather for their summit in Cornwall to focus on pandemic preparedness, to recognise the importance of scaling up support for community health systems in lower income countries, as a shared health security priority. So let's get tweeting our support using that hashtag Malaria Win-Win. Once again, thank you so much for joining this event. We hope you have a very lovely day. From all the sponsors, from Malaria No More, and from me, Kasia Madera, thank you. Have a good rest of your day. Take care.